everybody, welcome back to our YouTube channel. Today I wanted to talk about English in the interpreted encounter and more specifically about patients. Oftentimes it's said that the patients are non-English speaking, and that's a big misnomer, and I want to explore that with you a little bit. The real question that you need to ask is how much English does a person speak? Because there's a lot of variations. I'll give you an example. My husband is a programmer. And so he'll talk to me about his projects and the things he's working on. And for a while I'll follow, but eventually as he gets more excited and he gets more into the technicalities of programming, I'm lost. So it's not that I don't speak English. It's not that the words that he's saying to me don't make sense, but the context in which he's speaking of them loses me. I have no idea what he's talking about after a while, and I have to tell him, hey, can you step it back and simplify it for me? I also have musicians in my house, and so they'll start talking about theory and concepts and different things. They're speaking to me in English, but because it's a technical area of expertise, I get lost. And so if you think about that, you can know English, but the technicalities in a healthcare setting are very complex. So think of the last time you went to the doctor. Did you understand everything that they were saying? Did you need to ask for clarifying questions? How did you feel? Were you excited to go to the doctor? Were you like, yeah, I get to go to my doctor today? Doubtful. I see providers consistently, and while I enjoy their company, I think they're great at what they do. It's not something that I'm like, oh, what can I do this week? Oh, I know, I'm going to go to my doctor. That's not the way people look at it. You go, you're nervous, you're dealing with issues that you're uncertain about, and so your emotions get elevated too. Sometimes you even choose to bring a spouse, a family member, a friend to help guide you through your medical visit, depending on its complexity. And so when we talk about the patient population that we work with, it's not that they're non-English speaking all the time, but they do have limited English proficiency. So in the interpreting world, you hear a lot about LEP. And if you're not in the interpreting world, people don't speak English, so they must be non-English speaking. And so it's important to understand that there are varieties. You have patient populations who will function well at work in English, who can talk to their neighbor, who build up friendships, who might go out together. But when you get into the full technicality of a healthcare environment, that's where things waver. So I've heard different stories of interpreters in the field where one time somebody went to interpret for a patient and then the patient got in the room and they handled the entire encounter in English. And so the interpreter's like, well, my time was wasted because they spoke English the whole time. Well, not necessarily. It could be that an interpreter is there to make sure that something's not missed. Recently, there was another post about an interpreter who had asked the patient, hey, do you speak English? The patient responded back, no. And then again, during the encounter, they were able to answer the doctor's questions in English. That doesn't mean an interpreter isn't necessary, because sometimes we don't know how complex something is going to be. Especially in this time of COVID, people aren't able to bring that support system or bring somebody that can help them remember or know what's going on. And so to make sure that nothing's lost, an interpreter is present so that there isn't anything that's not clarified. So it's not that patient populations are non-English speaking. They're limited English proficient. The well-known acronym is LEP, and interpreters are there to help healthcare providers work with their LEP, limited English proficient patients, to make sure that everything's communicated well and there's no questions at the end. So thanks for watching. Be sure to subscribe, comment, share our link, and we'll see you soon. Have a great day.